Each ADL should be documented with specific details about the patient's current ability, the assistant required for any safety concern. So first one is bathing. We need to know, how is the patient receiving hygiene care? Is it sponge bath, there's shower, partial assist, shower chair, bed bath? I can tell you many times a patient would be getting a bed bath, but we have on the HHA care plan shower. And the reason a lot of times that we don't know to update the home health aid care plan is because we're not asking. We're assuming they're taking showers, or we see it, but then we forget to update the home health aid care plan. So we need to know what kind of method are they using for the patient's bath, because sometimes the patient could still be ambulating and they're still giving them a bed bath. Assistant needed. Are they one-person assist? Are they total care? Do not assume just because you're seeing the patient walking that they don't need assistance. You need to look at their skin condition. Dressing. Can the patient dress themselves? Are they able to dress their upper and lower body? What type of assistance do they need to, even simple things as buttoning their zipper or their buttons, or do they need full assistance? Toileting, that's a big one. Patient could have started being incontinent, and then we've been seeing them go into the bathroom, and they've been telling us that they're incontinent, but we're not asking those questions regularly. They could have changed from being incontinent to being incontinent, and because we're not asking those questions, we don't know that. Use of assistive devices. When it comes to patient being incontinent, are you using the bedpan? Are they using the commode? Are they using incontinent brief? Do they need help to go to the bathroom? Or do they need full care? Transfers, can the patient move from bed to chair? Or they high risk for fall, risk concern, safety concern? Do they have difficulty bearing weight, increased fatigue? Their walking ability when it comes to mobility, use of assistive device, cane, walker, wheelchair. And one of the things we need to make sure is that we are assessing and comparing from the last time. So an example of that is patient now unable to ambulate, requires total assistance for all ADLs,